The Saaving project, which is short for Student Advisors and Food Access for Vulnerable and Food Insecure Nutrition Groups, assists in providing adequate nutrition and nutrition education to the homeless and impoverished population in Spokane.
Our target community for this project is the vulnerable population of Spokane, defined as patrons of local food banks and recovery shelters. This population is often, but not always, living below the federal poverty line or making less than $12,060 per year. This population is also more susceptible to food insecurity, or the inability to access sufficient quantity and quality of food in socially acceptable ways. It is estimated that over 50,000 people in Spokane County are food insecure. Shelters and food banks provide meals and services for 87% of Spokane's homeless population. The city of Spokane reports that homelessness has increased 11% within the last few years to a total population of 1,090. Although the vulnerable community is more likely to be impoverished, homeless, or food insecure, the Saaving program is also available to those in addiction recovery or women and child crisis shelters, regardless of income or housing status.
To assess the needs of this community, we partnered with the Union Gospel Mission to seek ways on how nutrition services may play a role in their 16-month recovery program. We met with 18 men to discuss what services can be provided to them from a nutrition standpoint. After talking to the men at the Union Gospel Mission, we found out a handful of them would like to learn how to cook, what foods they can eat to stay full, and learn about various foods and their health benefits. Many of the men had great interest in one-on-one nutrition counseling and exercise counseling. Nutrition education presentations also sparked many people's interest, as several of the men wanted to learn about specific nutrition topics, such as GMO foods and whether or not they are safe to eat, and intermittent fasting and how it's beneficial to their health.
Another method of data collection included an interview-based survey of local restaurants and grocery stores. 16 restaurants and grocery stores were asked to participate, of which 3/4 accepted to complete the interview. 2/3 of those surveyed regularly donate leftover food to United Way, Blessings, or Salvation Army, and 63% of them regularly donate to Second Harvest. In fact, 38% of donors were large ownerships who established food donation protocol prior to opening up a new branch. Estimates of food waste averted varied, but responses of weekly contributions included 1,000 bagels, 120 pizzas, 35 pounds of salmon, or 15 full shopping carts. Those who were not donating cited a variety of obstacles, including company and government policy, quality and freshness of the product, and lawsuit prevention, the latter of which was only cited by one business owner. A few businesses were already participating in their own charities, such as Ronald McDonald House. Donating businesses described that donating service relationships were convenient and recommended interested businesses simply contact local food banks to get started.
Phase 1 of our project would be to start nutrition and exercise counseling at the Union Gospel Mission. Later on, we plan to incorporate cooking demonstrations and nutrition education presentations. Phase 2 of the project would include purchasing a delivery van to deliver excess food from restaurants to shelters and food banks throughout the Spokane area. Along with the delivery van, we would purchase insulated cameras to keep the food either hot or cold. As a whole, the community would benefit from this project. Food waste would be decreased, more food would be provided to the homeless. Homeless would be able to obtain nutrition counseling and education, and students studying nutrition would get experience counseling.